lots of people who maybe they were going to run a marathon or whatever, lots of weight loss. Is that what people who were saying, I really want to lose this part of my stomach, and I would see that it really isn't something that they were going to lose. They really needed to maybe have it.
How do you feel about all the Ozempic and all that kind of stuff?
It's great for a lot of people. Some people that genetically have a harder time maintaining their weight, and it's a great tool. It's not to be used alone. It's for changing your diet, your exercise, and you're taking care of that.
You started your Instagram page.
I realize people have no idea what any of these procedures are, what to expect. An outlet for me to release some of the snarkiness that I would feel sometimes.
Because there's so many places you look and there's different information.
I'ma kick back when you say like that.
Welcome to Beauty Unveiled. I am Dr. Angela Sturm, and today I have with me the beautiful Dana Omari Harrell. She is from IG Famous by Dana, knows so much about plastic surgery, skincare, beauty, fashion. I see all kinds of stuff on your page.
Thank you. Thank you. Yeah, it's so much fun.
Well, thanks for being with us.
Thank you for having me.
Absolutely. So we were chatting a little bit beforehand. So tell me about you, where you're from, how did you get here? How did we get to IG Famous by Dana?
So I'm from Tennessee, but I live in Houston now. I actually am a registered dietitian. I did all of that. I have a master's in biochemistry, started in the hospital system, and then I was working for it's new, oh my gosh, I can't even remember the name of where I worked. New Life Wellness Med Spa. Mm-hmm. That was my very first med spa that I worked at. I was only 25 years old. And they had me in charge of their entire wellness department. And I also did clinical outpatient nutrition for Tomball Hospital.
So how'd you get into nutrition?
Really, I started in school in architecture.
Oh, wow.
For 2 years at the University of Tennessee. Realized that I love design and I love architecture, but I did not want to be an architect.
It's a lot.
It's just not what I thought it was going to be. I thought it was going to be more design, and it's more, I don't know. It was just not for me.
Yeah.
I have always loved science, and I was taking science classes. I knew I didn't want to be a doctor because my idea of a doctor was either you're a PCP or you work in a hospital, and both sounded miserable. And I mean, looking back, I probably maybe should have been a plastic surgeon with like architecture. Like I have the eye for like design,
science, and the build. And
But I was like 20 at that point because I dropped out the end of my sophomore year of architecture school, and I just switched to sciences. And I was taking all of the pre-med classes, knowing I definitely didn't want to be a doctor, but didn't know what else to do. Mm-hmm. And then I was really interested in nutrition. I don't know why. Sports, maybe.
Yeah. Did you play sports growing up?
Yeah. But I thought maybe being a sports dietitian would be cool. Mm-hmm. And I don't know. And I just went through it. And I really enjoyed being a dietitian, like working in hospitals and stuff. But I fell into this. I didn't know that doing any of this was a possibility.
Yeah.
Yeah.
And then you started working for the med spa. And you were saying you were like doing some inpatient.
So I was doing outpatient dietetics. Like clinical, so like cardiac rehab, diabetes care, things like that. And then for the med spa, I was doing more wellness, sports nutrition. So there was lots of people who maybe they were going to run a marathon or whatever, lots of weight loss, especially for the ladies coming in at the med spa. And they very quickly realized I was really good at doing consultations because I was selling a lot of laser. There's a plastic surgeon that's affiliated with them selling, procedures, because I would have people who were saying, I really want to lose this part of my stomach. And I would see that it really isn't something that they were going to lose. They really needed to maybe have a tummy tuck. Mm-hmm. And so they realized I was really good at consultations and managing expectations for what can be done. And so then first of all, they moved me up into assistant and managerial positions. And then they had me training the other providers, plastic surgeons. And pretty soon I had other plastic surgeons and other med spas that were hiring me to come train their people to have good consultations. And it just blew up from there.
Yeah. So I know we're getting off topic a little bit. So with your background, how do you feel about all the Ozempic and all that kind of stuff? Is it a good idea? How do you feel?
I think it's a tool that it's great for a lot of people. Mm-hmm. Actually, when I was practicing, we had Contrave and a couple others that are like precursors, or they were the very beginning GLP-1 agonists. Some of my patients were on Victoza, which is, I can't remember what it's called, but it's on a liraglutide.
Okay.
It's the oldest of that class of medications. And I mean, it quiets the food noise in their head. There are some people that genetically have a harder time maintaining their weight, and it's a great tool. It's not to be used alone. It's for, you're changing your diet, you're exercising, you're taking care of that. But, why would you want to make it any more difficult than it has to be?
Yeah. Yeah. And I think it's important you say that, like, it's a whole process, because I've talked to so many people and they're like, I got off of it and the weight came back. And I'm like, well, did you make any changes?
Like, no, I'll just get back on it. And you're like, okay.
All right. And then, and then you started your Instagram page.
Yes. So while I was doing all these consultations, I realized people have no idea what any of these procedures are, what to expect. And honestly, there were things that were said to me that I was like, I cannot believe that people think this. This is insane. But you can't say that to a patient or a client. You can't go, that's stupid. Why would you think that that's how this would work? And so it started kind of as an outlet for me to release some of the snarkiness that I would feel sometimes. And I don't know, I guess people like snark because
they love it.
It blew up. It blew up. Yes, especially with the celebrities. If I said, okay, do not let this girl tell you that this is not anything but lip filler. It is not makeup. It is lip filler. We're talking about Kylie, obviously.
Yeah.
That was one of the first ones. And people loved it, and it just blew up.
Because you're honest. I love that you're honest, because there's so many places you look and there's different information, and some people are kind of skewing to sell whatever they're selling, or, and oh my gosh, like you said, that's not how that works. I love that you're real, and I'll read stuff and I'm like, yeah, I'm so glad someone's saying that, but obviously you didn't ever think it would turn into something.
No, but I feel like that I found a niche that I guess needed to be filled, and I did not realize it, and here I am.
Yeah, absolutely. So how do you get all your information? Because you know a lot. Obviously, you've been in the industry, you know how things work.
All sorts of research, things like working with plastic surgeons like Ashley, Dr. Steinberg. I've been so fortunate to be able to sit in on some plastic surgery procedures, some surgical procedures. Being in the OR is awesome. I love it.
See, you should have been a surgeon.
Yeah, it's so funny because every time I am filmed, a lot of times it's the surgeon wants me to film something for them to have content or to talk about. But every single time I go into the OR with a new surgeon, they're like, okay, if you feel wheezy or queasy, if anything, I'm like, no, I can see all of this. Yeah. It's going to be great. I mean, even I have pictures and videos of myself, like when I got my bleph and there's like a fat glob like coming out of my eyelid. And Dr. Rose was like, if this is going to make you feel sick, I was like, no, this is amazing. I didn't know I had that much fat in my eyelid.
You're like, yes, take it out.
I was like, did you get all of it? Yeah. All that needed to be taken? So, yeah.
Yeah, I feel like people are one way or the other. You're either like, oh, that's so interesting, or you're like, nope, that's okay. So,
well, I mean, with surgery, I think it's so interesting. But then there's some things that gross me out. It's not like I get sick or anything. I'm just like, I don't know why people want to watch this. Like the really disgusting, like Dr. Pimple Popper, where it's like obviously a cyst and it's like the size of a baseball. Like that's what you want to watch in your free time?
Yeah,
Ugh.
I don't find that as satisfying as
many
other people do.
Yeah.
I'm like, I've seen it, I don't know. But like, it's like the end product. I think that's what all of us like, the end product. When you get done with a rhinoplasty and you're like, that looks so pretty.
Oh, I agree. People love before and afters. Except then there's some people who are like, I can't see a difference. And I'm like, in this before and after, this is not even subtle.
That's always the thing, right? They're like, I can't see a difference. There was a facelift before and after I had, and they were like, I can't see a difference except for the jawline and the neck. And I was like, exactly. You got it.
But a lot of people think a facelift is up here and
right.
not down here. So
You're exactly right.
I even started having to say, or I was saying full facelift.
Yeah.
Because people think just this is a partial, even though this is the facelift.
Yeah, it's so not clear. And I blame the plastic surgeons, and when we first started, for naming it the wrong thing.
Yeah.
Like now I'll say lower face and neck if this is what I mean, because I'm like, I want to be very clear, you know, like what we're doing.
Right.
So we're all on the same page, because you're exactly right. You think face, and you're like, well, no, this is the brow, and this is a bleph, and this is a, you know.
Yeah. And in the like reverse of that, you know, with the ponytail facelift, you know, whatever, which is a trademark, just it's really just, you know, your eyes and your, I know, you know, but for everyone else,
Yeah,
it's
absolutely.
just the in the tail ends of their brows and a brow lift. People don't realize that that's actually they do from the mid face. They think they're literally just lifting up here. They're like, that's just the upper part. And I'm like, they do the mid face too.
Right.
They're not lifting here and leaving this all hanging.
Right. Exactly.
Like it's going to create a weird gap between.
Yeah. It's very confusing what like a facelift means. And then you have all the branded facelifts, and they're like, well, do you do the vertical lift? Do you do this? And I'm like, okay, well, it's a deep plane lift, and good for people for putting names on stuff because it works, you know, like I'm sure has worked very well for the people that put the names on the things. But I was like, okay, so this is what this really is, you know?
And so that's now something that I educate on, because I'll have people who are like, I was looking for a ponytail facelift, but the only person that does it is surgeon in Beverly Hills. And I'm like, no, almost every facial plastic surgeon who does lifts does this. They just don't call it that because that's his trademark word.
Right.
So,
and you know, as a consumer, I'm glad you do educate on that, because otherwise you don't know, and you're like, well, I want this, you know, because that sounds good. And there's certain things that seem like it's for everybody, but maybe it's not for everybody. Like ponytail lift, maybe not for everybody, you know. For the right person, amazing.
Yeah. Well, that's another thing. People think that surgery is going to give them the exact feature that someone else has. Like they think that it's almost like a Mr. Potato Head. Like you can pick someone's nose and be like, I want that nose. First of all, even if that were possible for the surgeon to give you that exact nose, you're not thinking about the rest of your features, and it might look so weird. Like a teeny tiny nose on my face is going to look crazy out of place, you know, and they don't get that sometimes.
Yeah, it feels almost like commoditized. We're like, this is a rhinoplasty, this is this is that. And you're like, well, it's a range of things, you know, like there's some art to it. And like you said, what are your other features and what looks good on you, and what are we starting with? What is your skin like? You know, a lot of different things that go into it. But maybe it's just trying to understand it from the patient side with so much information, you know, and you're just trying to categorize it and to figure it out. And I don't know how we make that better other than educate, maybe.
Well, that's where the consultation is so important. So understanding what they're actually asking for, and then being able to explain why this is the right choice, or what all of their options are, or why it's not a right choice. Because I do know some surgeons that are more like almost like paint by numbers. Or if someone comes in and says, I want 360 cc, you know, whatever high profile, they just name off what their friend did, and their boobs look, their friend's boobs look great to them. And the surgeon's like, okay, this is what you want, this, you know, whatever, and doesn't walk them through, okay, it sounds like they know what they're talking about, but I need you to actually show me, like describe, let's look, show me where you want them placed. How high do you want your breasts to be? How big do you want them to be? And sometimes when you have them try to explain that way, you'll realize that they don't want what they actually asked for. It's just that's what it looks like on their friend and not on them. And then you explain, okay, well, these are what your breasts are like. This, to get that or the closest to that end result, we're going to have to do this or that. And usually then they go, oh,
okay, that's what I want. I want it to look like that. And you're like, okay, how do we get to that? You know,
exactly.
And it's communication. Like, I think it's, you know, communication on both sides, us figuring out what they mean, and like them being able to communicate what they want.
And it's really hard for them to communicate because they don't have the words.
Right.
And they're already, you know, really confused with a ponytail lift, a lower facelift, an upper facelift, a full facelift. You know, and
what do all these things mean?
Yeah.
Like, I want to look better in my pictures. And
well, that's why I feel like one of the best questions to start asking them is, what would you like to improve, or what would you like to enhance? And then from there, can you show me some examples on your picture, or are you pulling at your face this way? Like when they say, I want my eyes to be lifted, then you can ask them if they're doing this, or if they're doing this, or if they're pulling at their eyelids. Now you kind of get an idea of actually what they're looking for.
Right, exactly what we're trying to communicate.
Yes.
I feel like I'm not seeing as much of like the fad surgery. You probably know better than me because you're on the pulse. Like the things that, like the fox eye and things like that I was like, how is that going to age?
I feel like that's kind of fallen out of favor, but I feel like buccal fat, and I actually saw the American Society of Plastic Surgery report came out almost 2 weeks ago.
Mm-hmm.
And buccal fat is just like rising like steadily. What do you think about that?
I think in the right person, it's nice. It's not for
I agree.
Everybody. I think people think it's going to do things it's not going to do. They're looking more at like their modiolus or like the little babyish jowl, and they're like, oh, I want it to do that. And you're like, well, it doesn't really do that.
The fat pad on the inside, not the outside.
Yeah. And you can tell, I feel like you can tell, like it's almost that chipmunk cheeky look that you're like, that's going to be great,
That's what I say. So I always use Kanye West as an example because one, I don't like him, but he would be a great candidate if he wanted to. Not saying that he needs to have anything done.
Right.
But unless you have that chipmunky face, like you said, and I would explain it to people, if this part of your face is wider than the whole top half, like your cheeks, your forehead, all of it, and it's sticking out right here, not your jaw, but right here, then you're probably a really good candidate for it. But otherwise, you're going to look very like...
Yeah. It's either going to be so subtle that you're like, I don't know if that was worth it. I've seen a lot of subtle, or it's, like you said, it's like so much. And I've seen also the other side where you're like, you look so thin, where... How does that, I know they'll age okay, but it's maybe not look as healthy as maybe it could.
I mean, I don't know. I feel like that gaunt look, and then it's not like it's very easy to correct that.
No.
So you can't just inject fat and just hope it's okay.
Right, and it'll just go back the way that it was.
Yeah.
It's always easier to take out small amounts of things and then take out more if you want to, you know, with everything. I feel like the amount of people that it's good for versus the amount of people that want it, it's not equal. So. And so you got married 2 years ago, right?
No, last year. Yeah.
Okay. And y'all were college sweethearts, right?
Yes, we met at the University of Tennessee. So we've been together a long time, but we got engaged like the very end. We were supposed to get married in 2020.
Well, and then probably like everybody else.
Yeah. And then it was just a shit show trying to get anything planned. And anyway, we completely changed our plan, which I'm actually happier for. And we got married last year and it was really fun.
Yeah. And family maybe?
Oh, no, we are not having kids. I would love to be the rich aunt.
It's so much easier. You get to sleep. You can go where you want. If you have animals, they always love you. So when people are like, I'm like, oh no, you can travel. Like my kids are wonderful, but there's things I miss. I miss the traveling like a lot. Yeah.
I know. People will tell me when I say the travel, they're like, you can travel with kids. I'm like, that sounds horrible.
I can't.
It sounds horrible. And then there are people who are like, oh, you can get a nanny. I'm like, that's expensive. Like, do you know what I could do instead of paying the couple $1,000 to have a nanny come and stay with these children? No, thanks.
It's expensive. And then there's like the guilt associated with that, where you're like, oh, but that really should be me. And like, I don't know. Oh, my significant other, he mostly stays home, and still there's even a little guilt with that where I'm like, I'm really glad it's her dad that's with him, but still like, it's usually the mom, and people will ask me questions and I'm like, I don't know.
No, I love that. I mean, I feel like there should be more house husbands like there are housewives,
Yeah.
If you don't need the other income, why would you want a stranger taking care of your kids? Like if he doesn't, not to say that he doesn't have a career, but you know what I mean? Like if he's super happy being at home and taking care of that, why is it okay for women and not men? I think that's wonderful.
Yeah. And then they can have that time with their dad, which I think is so special. And it's important to have that, as two girls, them to grow up knowing he thinks they're wonderful, I think is super valuable. So it's fine. It works for us.
No, I've seen him with your kids. Very cute.
He's a great dad. I'm like following behind them, like trying to figure things out. So. So would you ever want to be in a plastic surgeon's office again?
I mean, I wouldn't mind it, but at this point, I don't think that they would be able to afford me. Like Dr. Rose, Dr. Rose is always like, just come work for me. And I'm like, oh my God, Dr. Rose, you don't understand how much, like what's the word? How much money, what's the word for like having like, when something makes a lot of money that, I can't think of the word.
You'd be very valuable.
Well, because like at this point, I also help with making content creation, being cross-posted on my page, things like that.
Do you have like a team or do you?
No, it's just me.
Wow, it's just you. That's
just me.
Awesome. That's amazing. That's a lot of work.
Yeah, but I really enjoy it. So it's fun.
Yeah.
Yeah.
From architecture to content creation. I mean, I guess there's structure, right?
I feel like all of it is kind of related, like background in architecture, background in just design and art, and then also in science. So it's, I can talk about these things, but I also have the eye for it. Like even just looking at patients and stuff, I really had like a really good eye. There are things that I've had done to myself, like my lip lift, which I had with Dr. Rodman. At first she was like you could maybe, like, you're on the edge. I was telling Dr. Rose and Ashley, Dr. Steinberg, and they were like, don't do it. It's not worth the scar. Like, it doesn't even look like you need anything. It's better for older people. And then after I had it done, they were all like, that changed your face. And I was like, I know. I knew it would. Great. I knew the proportions, and I knew what it would do. Dr. Rodman believed in me, and now I talked about it, and she says she gets tons of messages of people who want a lip lift. And I was like, see?
And there's something we said for that, subtle, but it's just the right proportion. Just like you said, it looks beautiful. She did a great job.
Thank you.
And that eye, that's something you can't teach. It's hard. I don't think you can teach it.
No, you can't. And going back to when I said, I know surgeons that are paint by numbers, but I also know surgeons who they can do a great nose job or they can do great boobs, but it's not that it's bad, but they don't really totally have an eye. Like they wouldn't think like just a tiny, like a millimeter more this way or a millimeter more that way would change the balance. They're just like, okay, we're just gonna make it a little smaller, make this straighter, narrow this, and it looks great, but they're missing that, what is it? Je ne sais quoi, like quality.
Yeah, I agree. I think there's, we're paid to be judgy, and there's ones that I look at and I'm like, yeah, I mean, it's better, like the hump is gone, it's better, but then there's ones where you're like, it's pretty, like it's just really pretty.
They really know how to like do everything. So having the eye and having the science background, I think that's what makes my page so good.
Yeah, and being real, and like I said, just
transparency.
Transparency. Like, no, that's not what that is.
Yes, I show all of the stuff I do, which is, I always say all of it. I haven't had a lot done, but yeah.
And people, they want to know, like, what is it like? Like, the lip lift, does it hurt? Is it, what's the recovery like? And like you said, the way Dr. Rodman does it and the way I do it too, it's like, the incision's great. It's beautiful. And I think the people that are afraid of it are maybe do it like an older way where, that's fair enough. The incision was probably not the best, you know, but we've advanced a lot. And
And also I totally live by, I would rather have the scar than the thing that was bothering me.
Yeah.
Like, especially this is so true for like breast lifts. I have so many like friends, women who talk about it and they're like, I just don't want the anchor scar. Like I would rather have the anchor scar than be really self-conscious about my breasts. Yeah. I mean, that's not an issue that I'm concerned with right now, but if it were, I would say scar every day.
Yeah. Then you feel comfortable and you can wear what you want to wear and you're not conscious of that thing. So let's say top 3 procedures. What
for people or on me?
I don't know. Either way. Just in general that you think are worth it.
Oh, hands down, the best thing I've ever done was my bluff. And it's still pretty subtle, which that's what we wanted, but I'm still like, oh my God, I love. So the top 3 for me, and I think two of them I think are great for everyone. You know what I mean? Not everyone.
Yeah.
Everyone who is concerned.
Yeah, for sure.
Chin lipo. Again, I went subtle with that too, and I'm still super happy. But now, after seeing my sister after she went to Steinberg, I'm like, I think I need more. Like, wait, maybe I could do just a little bit more. And then for me, my lip lift, I'm obsessed with. People, when I show the side by sides on my page, they're like, oh my God, like you look younger, but I wouldn't be able to tell why. And I'm like,
perfect.
Yes, because this lengthens with age. Unfortunately, mine was already longer because genetically, and also from my nose job because it, just made the space look different. But yeah, my lip lift.
Yeah.
For other people, I think bluff is, for many, many people, just going to be life-changing. A chin.
Yeah.
I mean, I do have chin filler from Dr. Steinberg, but a chin, people completely discount how that can really change your face without anyone realizing why. And chin lipo, if you have.
Yeah, that little bit. Yeah, it can make a huge difference. The bluff is great because it's not painful. The downtime is easy. You can put on sunglasses and go, and it makes a huge difference. It just like brightens up your whole face, I think. So
it opened up my eyes.
Yeah.
What about you?
I had my nose done at the end of my fellowship, and I'm glad I did. Like, that was one of those, like, change the way you look, but people can't totally put your finger on it.
Right.
And then I've just done injections and things like that. But I think for other people, like, bluff's huge. I agree with you. I think that's a big deal. For the older crowd, like the facelift, I have people that come in and they're like, did anybody get a facelift this week? I'm so jealous because it was the best thing. I just felt so much better about myself, obviously, like.
Oh, no. I have my facelift surgeon picked out, and Ashley has been airing it out, and now we're not going to be able to afford her because she keeps talking about it, and I wish I'd never told her.
She doesn't keep secrets. So.
No. I told her I'm going to find a new facelift surgeon. I'm not telling her.
Yeah, keep it a secret. Keep the price reasonable. Yeah, I feel like that makes a big difference. And I'm with you. When the time is here, for sure.
And they're really good. You guys are really good at hiding the scars, but I wouldn't even care. I'd be like, yep, here it is. Right here. See that silver line? That is from when I went.
Yeah, and see how good it all looks. Yes.
Yeah, I'm all for young facelifts. Honestly, these people who are getting at like 40 and 45, I'm obsessed.
It looks so good. They recover so well. Nobody even knows. Those are some of my ones that, like, social media, on TikTok especially, people are like, I can't see a difference. And I'm like, it's a huge difference. She just looked really good before, like they look good before, and then you see the jawline, and you're like,
they might really be looking at the brow.
Could be.
Because I already can see, like, I have the baby gels that you were talking about. I will be needing like a facelift here probably way before I need like a brow lift of any kind. Mm-hmm. So I'm feeling like around 40, 45, this will happen. Mm-hmm. And then maybe my second facelift at probably like 65, I'll need the lift with the second round down here, Yeah. Maybe like Zaza Gabor or any of these other like incredible women who've had like 3 or 4 facelifts by the time they're 80. I mean, you start at 40 every 15 years or so.
Yeah, and then you just never age and you always look good. That's my goal, that people are always like, you always look good.
You just used like the yogurt and honey that Jennifer Aniston did or whatever.
Yogurt and honey. That's exactly it. Yeah, that and what? The olive oil.
Olive oil. Mm-hmm. You eat some, you put some on your face, and then you never need a facelift.
Yeah, that's exactly how that works. Well, thank you so much for coming on the show. This was so fun.
This was.
I got to know you a little bit better, which I really appreciate. So, if you enjoyed, please like and follow Beauty Unveiled. You can find me at www.drangela.sturm.com, and you can find you, of course, on Instagram. And where else can they find you?
I'm really just on Instagram right now. So, I mean, I'm trying with TikTok, but
it's a different crowd.
I'm about to be 35. It's hard.
It is. Well, thank you again. This was wonderful.
Thank you.
When you fake it,